Good morning, everyone. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. The topic of my lecture today about fetal skull. So what we wanted to discuss today, the importance of the anatomy of the fetal skull bones, sutures, fontanelles. What is the diameter of the fetal skull? The foreplane of engagement of the fetal skull, and lastly, what is the cephalic or cephalic presentation? Let us start our journey. Why it is important to study the fetal skull? Because it is the most difficult part of the baby to pass through the mother pelvic canal due to the hard bony nature of the skull. So, understanding the anatomy of the fetal skull and its diameters will help in recognizing how labor is progressing. Okay, please look to this picture to see the fetal skull bones. It is formed from face, base, and vault. Look to this view. This is the lateral view, and this is superior view. Here in the lateral view, you can see the face, which starts from the supraorbital ridge and the root of the nose to the chin. This is the face. The base extends from the chin to the foramen magnum. The vault, you will see it in the superior view here, formed of frontal bones, anterior fontanelle, two parietal bones, posterior fontanelle, occipital bone. The two parietal bones separated by sagittal suture. The two frontal bones separated by frontal suture. The frontal bone separated from the parietal bone by the coronal suture. The two parietal bones separated from the occipital bone by the lambdoid suture. So what is the occiput? The occiput is this area. Can you see it in dots? This is the occiput, containing the occipital protuberance, and this is the suboccipital region. This is the occipital protuberance, and this is suboccipital region, and this area, all this area is called the occiput. It's the area between the base of the skull and the posterior fontanelle. This is the posterior fontanelle here. Okay, from the base of the skull to the posterior fontanelle, this part is called the occiput. What about the suture? Look to this picture, please. This is the anterior and this is the posterior. Okay, this is the anterior and this is the posterior. Start from anterior to posterior. This is two frontal bones separated by frontal suture. And this is two parietal bones separated by sagittal suture. And there is suture separating the parietal bone from frontal bone called coronal suture. This one is called coronal suture. Then this is the occipital bone separated from the parietal bone by the lambdoid suture. This is the lambdoid suture. And this is the anterior fontanelle and posterior fontanelle. Look to the other picture down here. From the lateral view, you can see the temporal suture. We have temporal suture on each side here. The temporal suture separating the parietal bone from the temporal bone. Okay? What about the fontanelles? We have two important fontanelle, anterior fontanelle as in this picture. This is the anterior fontanelle, the largest. And this is the posterior fontanelle, the smallest one. And this is of obstetric importance because it is helping in diagnosis of vertex presentation, the position of the occiput, the degree of flexion of the head. Another four non-important fontanelles, non-obstetrically important fontanelles. You can see them on the other picture upward here in the lateral view. At the anterior and the posterior end of the temporal suture, there is two fontanelles, sphenoidal and the mastoid, on each side. So I have four, okay? And I have another two anterior and posterior fontanelle. So what is the difference between anterior and posterior fontanelle? Anterior fontanelle, what is called the bregma. Please look to this picture. This is the anterior fontanelle or bregma, and this is a posterior fontanelle or lambda. Okay, as you see, the anterior fontanelle is larger. It is membranous. It has a membranous floor. It is losing shape, while the posterior fontanelle is smaller, triangular, and punifloor. Okay, the bone surrounding the anterior fontanelle, four bones, two frontal bones and the two parietal bones, as you see here. While the posterior fontanelle surrounded by three bones, the occipital bone and two parietal bone. At delivery, the anterior fontanelle is open, still open, till 1.5 years after delivery becomes closed, while the posterior fontanelle is closed and ossified at full term. Okay? The surrounding bone in anterior fontanelle don't override when molding of the head occur, while when molding occur, in the posterior fontanelle and the surrounding bone, one parietal bone overlap the other, or approximate to the other, or overlap the other, and overlapping the occipital bone. This is the difference between the anterior and posterior fontanelle. What about the diameters, which is very important? I have two types of diameters: longitudinal diameters and transverse diameters. Let us discuss the longitudinal diameters first, and we'll start with the sub-occipital pragmatic diameter 9.5 centimeter. Look to this picture, each color corresponding to the diameter. Okay, so this is a sub-occipital pragmatic diameter extending from below the occipital protuberance. This is occipital protuberance, so starting here from below occipital protuberance to the center of the bregma. This is called sub-occipital pragmatic, 9.5 centimeter, and this is the diameter of engagement in case of occipital anterior with well-flexed head. Another diameter is the sub-occipital frontal. The sub-occipital frontal, as you see here, starts from the sub-occipital region below the occipital protuberance, as you see here. This is sub-occipital, and extending to the anterior end of the bregma. Okay, it is 10 centimeter. It is the diameter of engagement in occipital anterior in case there is incomplete flexion of the head. Another diameter is the occipitofrontal diameter. Occipitofrontal diameter starting from occipital protuberance here to the root of the nose here. It is 11.5 centimeter. It is the diameter of engagement of occipito-posterior position. And it is the diameter that distends the vulva in face to pubis. Occipitofrontal 11.5 centimeter. Another longitudinal diameter is the submentopragmatic diameter. Submento means from junction of the chin and the neck, from the junction at this area, from junction of the chin, this is the chin and this is the neck, from junction of the chin and the neck to the center of the bregma here. It is 9.5 centimeter. It is the engaging diameter in face presentation. So this is called the submento bregmatic diameter. Submento vertical diameter 11.5 centimeter. Submento extend from midway between the chin and the neck, as we said before, submento to a vertical point. What is the vertical point? It is area midway between anterior fontanelle and the posterior fontanelle. This point is called a vertical point. Okay, so submento vertical extending from submental region between the tip of the chin and the neck here to a vertical point which is the midway between anterior fontanelle and the posterior fontanelle. It is 11.5 centimeter and it is the engaging diameter in case of incompletely extended face. And it is the diameter that distended the vulva during face delivery. Mean to vertical diameter 13.5 centimeter. It is the largest longitudinal diameter. Starting from the tip of the chin here to the vertical point, which is midway between the anterior and the posterior fontanelle. 13.5 centimeter. It is the engaging diameter in brow presentation, and it is larger than the largest diameter of the female pelvis. That's why brow presentation is undeliverable. Okay, persistent brow is undeliverable because the mean to vertical diameter 13.5 centimeter is larger than the female pelvic diameters of the anal. Let us go to the transverse diameters, and we'll start with the largest one, which is the biparietal diameter, which extends, as you see in the picture, between the two parietal eminences on both sides. Okay, the most prominent part on the parietal bone on both sides is called parietal eminence. It is 9.5 centimeter. This is the largest transverse diameter of the fetal skull. Another diameter is supraparietal subparietal, 8.5 centimeter, less than the biparietal diameter by 1 centimeter, extending from above parietal eminence on one side to below parietal eminence on the other side. Supraparietal subparietal. Okay, 8.5 centimeter. It engages in anterior posterior diameter of the outlet of the pelvis in a syncretism. Bitemporal diameter 8 centimeter. This is the bitemporal diameter between the anterior end of the temporal sutures. It's called bitemporal diameter, extend between the anterior end of two temporal sutures. As you see here, this is the anterior bitemporal diameter. This is the biparietal diameter in this picture. Bitemporal is small. It is 8 centimeter. It is the engaging diameter in face presentation. Then lastly, the bimastoid diameter 7.5 centimeters. This is the smallest transverse diameter of the fetal skull between the tip of two mastoid process, and nowadays it is of no obstetrical importance. In the past it has an importance during the destructive operation, which is obsolete nowadays, long time ago, because the mastoid process is very strong and cannot be crushed. In case of destructive operation, this diameter cannot be crushed. So any pelvis less than 7.5 centimeter diameter, never the baby can pass, even with using of combined cephalotripsy and cephalotribe, which is a crushing of the head, which was done in the past of the old obstetrics, and nowadays it is obsolete long time ago. So it is now of no obstetric importance, the bimastoid diameter, which is 7.5 centimeters. So the four planes of engagement of the fetal skull: when the head completely flexed in vertex occipital-anterior, or deflexed head in occipital-posterior, or slightly extended head in brow, or completely extended head in face. As you see here, this is vertex, this is brow presentation, and this is face presentation. Vertex, brow, and face. Okay, we said the largest transverse diameter in all is the biparietal diameter, which is 9.5 centimeter. What about the longitudinal diameter? It will differ in the all of four of these. In case of completely flexed head in occipital-anterior, the longitudinal diameter will be suboccipito-pragmatic diameter 9.5 centimeter. In case of deflexed head in occipital-posterior, the longitudinal diameter will be the occipitofrontal diameter 11.5 centimeter. In case of slightly extended head, which is brow or midway between flexion and extension, the vertical diameter will be the min to vertical diameter, which the longitudinal diameter will be the min to vertical diameter, which is 13.5 centimeter, which is largest diameters of the fetal skull and largest than the largest diameter of the pelvic inlet, so it is undeliverable. The brow is undeliverable because of this diameter. In case of completely extended head face presentation, the longitudinal diameter is submin to pragmatic diameter, which is 9.5 centimeter. So what about cephalic presentation? Cephalic presentation may be vertex, as in this picture, brow, as in this picture, face, as in this picture. Okay? Vertex, brow, or face. In case of vertex, what is the presenting part of the fetus? The area midway between the anterior fontanelle, the two parietal bones, and the posterior fontanelle. What about the brow? The area of the skull which extends from the anterior fontanelle to the upper border of the eye. What about the face? The area extended from the upper ridge of the eye to the nose and the chin. So during BV, you must feel the chin in case of face presentation. Okay? Thank you. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.